All right, here we go. Welcome, everybody. This is our Great Plains Good Health and Wellness program, welcoming you to our Community Health Wellness webinar. Very happy to have you here today. We've got an exciting webinar talking all about exercise is medicine with an old colleague of mine, Hope Klein from SDSU Extension Services. And so we're very excited. This will be, we'll have a nice conversation here. And at the end, we'll always, of course, leave room for questions and comments, things of that nature. Also, I want to mention beforehand, we've got a survey that we would love you to take to show us how we're doing and how we can improve and better these to better serve you and your communities. And that'll be displayed at the end of the webinar and also in the follow-up email. But here we are. So welcome again. Thank you for your time. We really appreciate that you take your time to come and join us for these webinar trainings. This is just a fun way for us to interact with you and to share with you some of the great things that we can do together for our communities. And so with this conversation, I just kind of want to get us started off on kind of like a baseline, a foundational level, since we're talking about exercise and exercise is medicine and some other, different programs that utilize these concepts and that are all research backed and things like that. So this is kind of where we're going, but I want to kind of back up a little bit from that. And I just to give us a little baseline, and I just like to do this for a couple of reasons. The one, it's often neglected. We usually tend to kind of just jump into things, especially when exercise is the topic. And when we do that, we kind of don't get the full perspective of why exercise is really important. And also it kind of limits options when we're talking about exercise, and also the intuitive wisdom that we all naturally have anyway. And so I feel like it's important to establish that baseline. So that's what I'm going to try and do right here. So exercise is just a component of health. And health, to give you a definition that I really like, health is an individual and collective attainment of balance. And so it has multiple parts, is another way to say it. And balance can be achieved by knowing and living our personal values in the 6 foundational principles of health, which is just a strategy or a model of health that I like to use. And so it has 6 components, right? 6 foundational principles. First is thinking, breathing, drinking water, eating, sleeping, and moving. So we need all 6 of these components in order for health to be achieved. And like I say, it's an individual and collective attainment of balance. So each of these individually are very important. Like I say, we're talking about exercise today, or movement, if you will. But collectively, they make the bigger impact. And so it's not just about focusing on one and being very, very good at that. It's about having that collective, that holistic approach and incorporating everything. And even within those individual aspects, like I say, we're talking about exercise and movement today. There's kind of a bit of a complementary opposites. A lot of people like split things and think of them as like competing opposites, but I like to think of them as complementary, meaning you have to have one in order for the other to be possible. And so exercise, the 2 opposing or complementary factors are pretty simple. We're focusing on exercise today, so that would be more of like a work in, which is one component of exercise. And I'm also going to share about a work out, which is the other component. Or I'm sorry, workout is what we're talking about today, the exercise portion, and work in is what I'll also discuss. But these are basically two opposite factors, 2 complementary factors. Both are needed in order for us to attain that balance within exercise in general, as a whole, that collective holistic circle, right? And so what is a workout? Everybody pretty much knows what a workout is and what it does to your body. Raises your heart rate, raises your breathing rate. It increases your thermogenic processes, it heats the body up. It burns a lot of energy, burns a lot of calories. In essence, a workout is a catabolic effect has a catabolic effect to the body, meaning it breaks the body down. Not a bad thing. Not a bad thing. In contrast, a work-in is movement or exercise that pretty much almost does the opposite. So it doesn't raise the breathing rate. It doesn't raise your heart rate. It keeps things pretty even. It may increase the heat of the body, but only enough to make you feel warm and full. A work-in is, like I say, it's more of an anabolic response with the body. So more of a building up process rather than breaking down like that exercise or the workout variety. And I just want to, explain the two, because we can't have balance without. Like I said, they're complementary. We need them both. And a lot of times what we focus on with exercise is that workout portion, which is what the rest of our conversation is going to focus on, because it is very important. But I just want to say there's another side of it also. There's that work inside, and both are very important, and you need to find the balance within yourself, or we need to help our clients, our community, find the balance within them, because it's all about options. Health and wellness in general is an individual choice. And so the more options we have, the more likely we're going to choose something that we enjoy. And the more likely we enjoy it, the more likely we're going to stick to it. So it's very important. So like I said, these are just the complementary opposites that work out and that work in, both very important. And like I say, I'd like to differentiate with exercise that there is two options, because exercise for a lot of people, that could be like a negative. It can have a lot of negative connotations. There can be a lot of bad history with exercise. You mean you want me to get hot and sweaty and you want me to exercise in this weather? There can be a lot of negatives associated with exercise. We're not going to be talking about any of those today. It's all positive. But like I say, if someone has a trigger reaction to the word exercise, we can show them that is just a portion, that's just a part of the equation, right? And so it's about using our words to help draw people to the programs rather than kind of scare them or push them away. And so that's really what we want here within our community and your community and everything like that. The more we can create this holistic picture within the eyes of our community, the more we'll have their buy-in. And that's really important. And that's kind of what this program and partnering with all the other programs is really all about. And so with that long-winded introduction, I would like to, it would be my honor to share the screen with Hope Klein here. Hope, I'll let you go ahead and explain who you are and what you do a little bit, and then you can go ahead and jump right into your presentation. But thank you for being here.
Yes, thank you, Sean. So yeah, I'm Hope Klein. I'm a health education field specialist with SDSU Extension. To give you a little bit of a background on me, and just so you can understand my credentials a little bit to what I'm going to be speaking about, I received my undergraduate and graduate degree in exercise science. I am a certified exercise physiologist, and then I also was able to go on and get a credential in exercise as medicine. So Sean kind of gave us a really good overview of exactly what exercise as medicine is, but really it's exactly what it sounds like. Exercise can be beneficial for a multitude of reasons. And while I'm going to touch on it in a little bit just for the first couple of slides, it's not something that I'm going to really dive really deep into, because it's something that so many people, already kind of know a lot about. So Exercise as Medicine is really an initiative to connect clinical care with evidence-based physical activity resources for all people. And really, the title of this presentation is Evidence-Based Programs to Meet Your Community Needs. And I just kind of want to elaborate on that a little bit more. Just reading that title, it makes me think like, oh, my physical community of where I'm at right now. And how can these programs that Hope is presenting on, how can they help my community? And I'm excited to share that with the 2 programs that I'm going to be talking about in today's presentation, due to COVID, we actually have been able to move both of them over into a virtual platform. So when I'm speaking of like meeting your community needs, we've been really fortunate to be able to expand the community from just a physical community to, when I say community, I really just think of all of South Dakota, because we have a couple of virtual physical activity programs that are going on currently or have recently ended. And we, had participants from East River, West River, Central South Dakota, really everywhere. So that's been a really exciting development. And I actually have to stop sharing my screen for just a second. Oops. Okay. Sorry about that, everybody. You always think you know what you're doing because you've done it so many times, but it never fails that there's something that goes wrong. All right, I should be set up and we should be back on task now. So kind of like I stated and Sean had kind of introduced, the physical activity guidelines aren't anything really new to a lot of people, even if you feel like you only have a grasp on the tip of the iceberg to what the physical activity guidelines are. It's likely that you already know as an adult, the minimum recommendation for physical activity is 150 minutes of moderate physical activity. I'm not going to dive into the physical activity guidelines. I'm sure everybody has heard it, or, if you need a little refresher on it, I encourage you to simply Google benefits of physical activity programs or guidelines. Sorry about that. But what I really wanted to be able to touch on was that the guidelines have been updated. So perhaps you've heard this. I feel like 2018 was forever ago already with everything that has happened in the last year. But the second edition of the physical activity guidelines did come out in 2018. And with the new guidelines, what's really great is that with anything, the more any topic is researched, the more benefits and the more science-based the information can become. So we're better able to understand and expand upon the many benefits of physical activity. So like I said, I'm not going to be broken record and dive into the physical activity guidelines, but I really just kind of wanted to take a moment to highlight some of the new benefits of physical activity that have come out of the 2008 edition or 2018 edition of the physical activity guidelines. So here, a lot of benefits of physical activity for adults and older adults are highlighted, but I've bolded and asterisked the newer ones that have come out with the updated research. So really what research has shown on top of the benefits we knew previously is that there's lower risk of several additional types of cancers. So there's bladder, esophageal cancer, kidney, lung, and stomach cancer. There's improved cognition. There's reduced risk of dementia, including Alzheimer's disease. And there's a lower risk for fall-related injuries. And then you can see in parentheses on that last one, specific to older adults. So, I mean, just looking at those new benefits that have come out in the research, I think that's huge. And that's just in addition to all of these other topics, such as improved quality of life, reducing anxiety, improving sleep, just improved physical function and just lowered risk of falls in general. So really, these benefits are wonderful. We can't iterate enough how good physical activity is. And you'll notice that I say physical activity, and I like to say physical activity because, like Sean had said, a lot of people have a negative reaction when you're like, let's go exercise. So I just like to always say, like, let's be active. How can we be active? How can we increase our activity levels? Because there are some people that do process that mentally a little bit better than being like, let's go out there and exercise. And they're like, yeah, no, thank you. I'm going to pass and you can go out and do what you want. But when I get into the 2 physical activity programs that I'm going to be talking about, you're going to be able to see a really direct correlation to these benefits of physical activities for adults and older adults and what our participants of our programs are experiencing. So while we've briefly discussed the health benefits of being active, I'm going to transition to discussing osteoarthritis and the impact of living a sedentary lifestyle and how much of a burden that can have on adults and older adults. So while there's a lot of forms of arthritis, I really want to focus specifically on osteoarthritis. And we're really focusing on osteoarthritis because it is the most common form of joint disability in the United States, and it affects anywhere from 1 in 7 adults. So in total, that's 32.5 million adults that osteoarthritis impacts. And there's, I think it's like 200 maybe different kinds of arthritis. And like I said, this is the most common one, but just think of all the number of adults in the United States and the world that are impacted by arthritis every single day, whether it's osteoarthritis or one of those many other kinds. And the next bullet here, we're looking at the lack of mobility. So one's inability to be able to be mobile, to move around. So whether they have arthritis or not is associated with increased mortality. So the less that you move and the less that you're able to move around is associated with an increased chance of death at a younger age. So we're looking at people who aren't being active and they're dying at a younger age. And then in addition, number 3 isn't helping them in wanting to be active because they have pain in their weight-bearing joints, which leads or amplifies their sedentary lifestyle of not being mobile, and it deconditions their body, so it makes it harder for them to just get up and, go to the kitchen, and get themselves some water. It leads to increased stiffness and pain. So like, I don't want to get up and go for a walk around the block because it hurts my knees, it hurts my hips. I breathe heavy and I get sweaty and I don't like it and I get tired and exhausted. So it's really just, this is a vicious cycle. The less somebody moves, the more difficult it is for them to want to be motivated to get out there and move because they're experiencing all of these difficulties. So while everyone has likely been told at some point in time that physical activity can improve pain and function. And on this bullet here, it says specifically by 40% in those with osteoarthritis. There are still so many adults who are inactive. They just don't want to do it. They know there's benefit to it, but they're not seeing that immediate effect of it. So they don't have the motivation to go out and do it. So how can physical activity help arthritis? So what is it that we can do to help individuals not feel so much stiffness and pain and experience that deconditioning when they're not being active? So there's a prospective longitudinal study of older adults, and this specific study took place in Chicago. And what they really found was that arthritis is the leading cause of disability. That's not something new. That's something I stated on the previous slide. And that lower extremity joint impairment is a risk factor for future disability. So if you're not sure what lower extremity is, it's your legs, it's your lower extremities. So that joint impairment, that knee stiffness, that knee or hip pain is a risk factor for future disability. So like I said, there's pain when they get up and move, and they don't want to get up and move because they're experiencing pain and they're not noticing an immediate positive impact of getting up and being active, so they don't choose to do it. And people with osteoarthritis have decreased aerobic functioning and muscle strength compared to those age-matched controls. So somebody with osteoarthritis or maybe another form of arthritis are less conditioned or less fit than an individual the same age as them who does not have arthritis. And those with decreased activity due to pain leads to deconditioning. So the study is really reiterating everything that I said on the previous slide. So after looking at this study, what these individuals in Chicago wanted to do is see if we develop a physical activity program that is geared specifically toward these older adults, would it help them? And I'm going to tell you that information in just a second. So one of the first of the 2 programs I want to share with you today is called Fit and Strong. It's currently active in 33 states, and it's recommended by the CDC, the American Physical Therapy Association, NCOA, Administration for Community Living, and National Cancer Institutes. There has been a crazy amount of research and to go behind the development and programming of Fit and Strong. It's been a program that's been heavily researched since the mid-1990s, and through doing all of that evidence-based research and efficacy trials, I always struggle a little bit with that word, it has been recognized as an evidence-based falls prevention program, which just simply is what it sounds like. It's a program that has been proven to reduce falls in adults and older adults. So when Fit and Strong was first developed, only physical therapists were certified or able to become certified Fit and Strong leaders. But as time went on with the research, they realized physical therapists are really busy and they don't have a whole lot of time to dedicate to doing a program like this to this extent, which we'll talk about the extent of the program in a little bit. So the next component of their research was looking at if we have individuals who have a background in exercise science or related field, or even have experience with leading other evidence-based programs, are the outcomes to the participants still as effective as when the physical therapists were the leaders? So those trials have been done and show that participants do experience the same results. So this is really great that any individual with an exercise or related field background and has that experience in teaching evidence-based programs is eligible to become a Fit and Strong leader. So this has really led to Fit and Strong being able to be spread throughout more states, more communities, and have a broader reach, because those who are able to be certified, it's not such a small circle of those who would be eligible. So older adults who complete the Fit and Strong program, it's helped them in these ways, and these are in the boxes on the left-hand side of the slide. So lower extremity stiffness and pain has been reduced. So pain in the knees and the hips and the ankles. They have increased leg strength and physical function, increased mobility. They have reduced depression and anxiety, and solid evidence shows that Fit and Strong impacts last out to 18 months. So it's not that, and this is 18 months post-program. So if I'm finishing the program this month, it would show that I still have long-lasting impacts a year and a half from now from participating in the Fit and Strong program, which can really go to show how Fit and Strong helps teach participants how to continue an active lifestyle and take what they've learned from the program out into life with them once the program is over. And I'll discuss a little bit of how we do that in just a moment. So Fit and Strong was developed by the University of Chicago in Chicago, Illinois, and it was developed for those specifically with osteoarthritis, but the benefits have shown to be present for other older adults or adults who are maybe living a sedentary lifestyle and want to become more active. There are a few different components of Fit and Strong, so it doesn't only focus on aerobics like, hey, we're going to walk, or maybe do a little bit of low impact aerobics, but it also has strength training built into it, health education, and group discussion. So about the first 60 minutes of the 90-minute session focuses on physical activity, and the last 30 minutes focuses on health education and group discussion, and I'll lay that out in the next slide. And what's really great about Fit and Strong is that participants set their own goals and develop their own personalized activity plan. So in the first session of Fit and Strong, the certified leader works with the participant to determine what is their 1 rep max. And if you don't know what a 1 rep max is, it's determining at what maximal weight could a participant do a specific exercise. So because it's easy to explain, this is not what we do in Fit and Strong, but a bicep curl. I feel like a lot of people know what a bicep curl is, just curling a weight up to their shoulder. So it would be at, can you hold a 20-pound weight in your hand or a 10-pound weight in your hand, do 1 bicep curl in a nice, clean, controlled motion. And once you finish one, would you be able to do another? Well, if you could, that wouldn't be your 1 rep max. You'd have to move your weight up higher. And if you couldn't do another one, 20 would be your 1 rep max. So I don't know why my slide just changed by itself. My computer is being taken over during this presentation, apparently. But so participants really work at their own fitness level. So it might be somebody who's never done any strength training and they have a lower 1 rep max, which is definitely fine. Or it might be somebody who has done some strength training and they maybe started a little bit higher weight. But everybody's weights are personalized to themselves so that you can benefit the most from the program at a rate that is right for you. And then, like I said, they set their own goals and develop a personalized activity plan. So through the health education and group discussion, the certified leader works through setting goals and setting SMART goals. What's realistic for you? What's a timeline that you're going to do? And then they actually sit one-on-one with the instructor about halfway through the program to discuss, these are the goals that I want to do. And the certified leader takes them through, do you feel confident in doing this goal? If not, what adjustments can we make to make you feel more confident, etc. And then also they discuss, okay, we're wrapping up the program, we're about halfway through. What is your plan for maintaining your physical activity? What are you going to do when this program is done? Great. What days are you going to do it? Do you know a time? What if it's raining or snowing outside? What's your backup plan? So that's something that's really been helpful to participants, is not just, oh, the program's over, this has been great, thank you, but trying to set them up for success once the program is done. All right, so here's the general class schedule for the Fit and Strong program. My images are coming through really weird, so that graph isn't supposed to be there, but I'll make sure to explain it. So the general class schedule, you can either meet 2 times a week for a 12-week period, or you can meet 3 times a week for 8 weeks. Each session is 90 minutes in length. So at every single session, you're doing these components I'm about to talk about. So the leader takes the participants through 5 to 10 minutes of warm up and warm up stretching. Then you move to doing about 20 minutes of aerobic exercise, which it can include a walking component, and then you can do some low impact aerobics. You can do some line dancing. We've had some participants that have loved line dancing, and we've had participants that absolutely hate it and like to be in the way back corner so nobody else can see them doing their line dancing moves. And then after that aerobic component is done, there is that focus of lower extremity resistance training. So we use these ankle weights that are adjustable. So they can be adjusted in half-pound increments. And there my slide goes changing again. They can be adjusted in half-pound increments. So you could have as little as a half-pound in your ankle weight all the way up to 10 pounds. Granted, we've never had anyone start at 10 pounds, and they shouldn't be, but that's the max that someone could go up to by the end of the program. After that, there's 5 to 10 minutes of cool down and cool down sustained stretching. And then that really wraps up about that 60 minutes of physical activity. And then, as I mentioned before, there's the 30 minutes of education and group problem solving. So this is always really great. You see participants begin to get to know one another. They invest in one another. They share stories, oh, I had that problem too, and here's how I came past my barriers. So it's always really great to see those relationships among participants blossom throughout the duration of the program. And what's even better, when we started offering Fit and Strong in a virtual platform through Zoom, we piloted it in October. So we've been doing it for about 9 months now, but we were thinking like, oh, participants aren't going to be able to connect with one another and form relationships. And I'm shocked to share that they actually still do. Some participants will sign on early so they can just chat a little bit before the program. And then they always enjoy the last few minutes of just being able to catch up. And in a session that I led in April, participants actually shared that they added each other on Facebook and how much they enjoy seeing pictures of one another's grandkids or children, and just being able to keep up with one another. So in COVID, when things were more shut down, that was something that was definitely beneficial, but we're getting a lot of rural participants that don't have a lot of interaction opportunities or physical activity program opportunities in their areas. So they've really appreciated that as well. All right, so my participant success story for Fit and Strong did not populate in my PowerPoint for whatever reason. So I did have a direct quote in here, and I know the participant's quote that I was going to share. It is an individual from peer, and she just stated how she had suffered from seasonal affective depression and how her and her husband both noticed the gradual change in her after she joined the Fit and Strong program. She joined a session that started in February 1st, so kind of in the peak of her seasonal depression really kicking in, and just how much more enjoyable and pleasant and what more positive attitude that she was able to be in because of the Fit and Strong program, because of her being able to be active and interact with others. And she also shared, this is my favorite story to share, that she's an older adult, she's got long, beautiful hair, And she came onto a class, I think it was like in April, and just was like, you guys, I have to share this story with you. I'm so excited. I used to wear my hair in a braid all the time, and I haven't been able to braid my hair in about 3 years because she didn't have, number one, the range of motion to reach her hair or her hands back, or two, the strength to keep her arms up and do her braid. And she's like, I tried to do a braid yesterday, and I've had my hair in in a braid for the first time in 3 years. So that was really exciting and a great success story to be able to hear. And on this graph here, you can see this is part of our pre and post evaluation. We asked participants before the program and after the program, to what extent has your concern about falling interfered with your normal social activities? That's not something I had ever thought about in my younger age of like, oh, I can't go to that event because what if I fall when I try to step up or step down from the curb? And that is a real fear for a lot of older adults. So that was really something interesting to learn, and hopefully you guys are able to see it. But the pre-survey, so the ones in blue are the results from the pre-survey. So you can see at the very bottom, it's only blue, and that's people were extremely impacted by their fear of falling from going out to social activities. And then the second from the bottom was quite a bit. So in the pre-survey, there were people that responded with that, and the gray is the post. So you can see that nobody had a fear of falling that interfered with their normal social activities, and not at all is at the top. So that was really great to see that their involvement in the program really helped them feel like they could go out and do more social activities and not live in that fear of falling. All right, so now I'm going to transition to the second evidence-based program that we offer through SDSU Extension, and this program is called Walk with Ease. It's developed by the Arthritis Foundation. This one is a 6-week program where you come together 3 times a week. It can also be 2 times a week, but we do really try to encourage 3 times a week. And you can either do this on your own in a self-guided format, or you can do in person with a certified instructor. And then, as I mentioned too, we do have the Zoom version of Walk with Ease that was created because of COVID. You don't get on Zoom and walk with one another. We just cover the health education components, work on goal setting, and highlight other important topics and kind of do check-ins with one another. And then you set your own walking time, and then you report back how many minutes for that week you were able to walk. As a participant in this program, everyone receives a Walk with Ease workbook, and participants learn about proper stretching and strengthening exercises, motivational strategies, health education for symptom management, and then as well as how to build your stamina and walking pace, or how to build up your walking program as you progress through the program. So as I said, it's also an evidence-based program. It helps participant improve their arthritis symptoms. So again, you're seeing that pain and stiffness that is experienced by a lot of those with arthritis, and increases individuals' arthritis self-management strategies. And it's also been shown to increase individuals' balance, strength, and walking pace. And while the Walk with Ease program was primarily designed for individuals with arthritis, similar to Fit and Strong, it was designed for those with osteoarthritis. It can be beneficial to anybody who's lived a sedentary lifestyle and is looking to become more active. Between our Walk with Ease and Fit and Strong programs, I believe the youngest participant we had was an individual that was 42, and she had arthritis, but she had extreme success in being involved in the programs. So the general class schedule for Walk with Ease, again, this would just be for the in-person version, is each session is 45 to 60 minutes. It can vary a little bit based upon the health education. So the first 5 to 20-ish minutes is health education. So toward the beginning of the program, the health education is a little bit heavier and lasts a little bit longer. But as you progress toward the end of the program, there are more quick topics, so there's more time for walking as people progress their stamina and are able to walk longer. Then it moves into 10 minutes of warm up and warm up stretches. And then you walk together as a group between 15 to 45 minutes. And then you have a cool down and cool down stretches. Our participant feedback with Walk with Ease, here my direct quote did show up. So this Walk with Ease participant, this was a worksite participant. So we've offered the Walk with Ease specifically to work sites as well as to just general community populations. But this individual shared that since starting and they're doing more scheduled walking and they have a better attitude in general. They know that they feel better during the day and have a clearer mind. They've gained back some of the energy that they had lost during a time of medical treatment and recovery, and that they're hoping that with a continued effort, they can gain back more energy and stamina. And what worksite supervisor wouldn't love to hear that? Like, I have more energy and I have a clearer mind throughout the day. That's something that I think we all would like to have during the workday, or just, your personal life when work is done. And then here it's comparing pre and post, before and after the program, just in general on how participants ranked their health. So again, pre is in that blue, post is in that orange. So you can see excellent people who ranked their health as excellent. That went up a little bit pre to post, but just looking at that very good and how much that shot up, and then those who ranked their health as fair or just good, I mean, like, that decreased because other people had shifted up to feeling like their quality of health had gone up due to the program. So those are really two really brief and expedited backgrounds on both of the physical activity programs that we offer through SDSU Extension. But now I want to transition to, so what works to increase physical activity? As you can see through the two programs that we offer, we really harp on, there is health education, there is participant goal setting. We really, and by we, I mean the program's, not like me as a leader, but through being certified in either of the programs, leaders are trained to help participants understand, okay, the program's ending, but now what are you going to do? You've made it this far, so don't just go home and not do anything anymore, but what can you do on your own? So really what works for increasing physical activity for individuals or small groups, guidance from peers or professionals, getting support from others, or even the use of technology. So like I said, both of our programs have gone to that virtual platform, which has helped so many individuals in rural communities or those who were not ready to go out into groups earlier this spring. And then from the community standpoint, having point of decision prompts. So is there signage in your community that promotes that walking path that's just down the road, or just being active in general? And then different school policies and practices. And then is there access to indoor or outdoor rec facilities or outlets? It amazes me. So I'm based in Brookings, and when we've had a Brookings workshop, it's amazed me when, we've been like, okay, what if it blizzards? What are you going to do? Where are you going to go to walk? I've lived here for the past like 15-ish years maybe. And I've had participants tell me areas you can go walk that I had no idea were present. So while you may think, well, we have all these options in our community, there's going to be people in your community that don't have a clue. So how can you reach them and let them know about these options? So having those community-wide campaigns, and really promoting communities designed to support physical activity. And then now my graph didn't pop up. I'm sorry, everybody. It shows up on my preview when I was looking through my slides. But why is it that we need to promote physical activity? This is really a repeat of what everyone has likely already heard. All of the money that goes into annual healthcare costs, and then the percent of premature mortality. Like I said, those who live a sedentary lifestyle have an increased risk of early death compared to age-matched controls who are being active. So these people are shortening their lives because they're not being active. So we really need to get out there. There's been the marketing for years of physical activity is good, go out there and be active. But there's not the support for individuals to go out and do that. So how can we make that change? So everyone really has a role to play. So for individuals, personalize the benefits of physical activity. Like Sean said earlier, saying the word exercise to some people is going to definitely turn them off and be like, yep, it's too hot. I want to be sweaty. Like, see you later. Have fun. So while you may think like, oh, well, I've asked my mom if she wants to go on a walk with me, but she says it's too hot. What's a different activity you two could do together that would maybe appeal to her more? If you have the relationship with the individual to help them set personalized goals for physical activity, or you even set your own and you share that with individuals in your household or your close friends so that they can help support you or maybe become involved with you as well. And then just getting individuals to develop the knowledge and skills to be able to attain those goals. So that's really what we try to do in both of our programs. And then as a family or caregiver, starting early, if you've got young kids in your life, whether they're your own or your grandchildren, really providing that positive feedback and being a good role model for yourself. I have a almost 7-year-old, and I like to go on evening walks here and there, and I rarely get to go by myself, which is amazing because she wants to go with me and wants to go for a walk, and I don't know a lot of almost 7-year-olds that like to do that, even though I'm like, "Oh, I want my quiet time, I'm gonna go for a walk," and I don't get that, but you know what? It's having such a good impact on her and her view of activity as she grows. So just being able to offer that and going for a little family walk, or even a neighborhood walk, if you've got some neighbors that would maybe be interested in doing a little walk with you in the evening, that would be really great. So really promoting activities that set the basis for a lifetime of activity. So not getting your family or friends used to, oh, we ate supper and now we're going to sit and watch TV all night. What can you do that gets you up and active, even though it might not be viewed as exercise? It's still being viewed as physical activity, which has wonderful benefits. So, taking action, what strategies can be done to promote physical activity aside from kind of what I've already said? So, this graphic came from the physical activity guidelines in the second edition that I mentioned at the beginning of this presentation. And it really just highlights the different sectors of how can physical activity be promoted. So it can be promoted through healthcare, through community rec, fitness, and park programs, just through education in schools, faith-based settings, media, public health. So really, in extension, we are lucky to have 2 referral coordinators who work closely with hospitals and clinics. So they're actually based in some hospitals and clinics 1 day a week, and they're able to talk with providers, get referrals from patients to, understand what the patient's going through, what is it that they're looking for, and then they're able to match them with some of our programming efforts. So that's been something that's been really nice to bridge the gap between community and clinical linkages. So we're trying to bridge that gap with these referral coordinators and get individuals in need aware of and into our programs. Um, so yeah, these doctors and physicians also we have like a prescription pad for our different programs that has an introduction to each of these programs, that they can prescribe this program. They have a 1-800 number to call, and then they can learn more about our programs. And then we also have a lot of different partnerships throughout the state in healthcare, business settings, faith-based settings, and then the community recreation programs, where they either have agreed to promote our programs, whether they're located near them or done virtually. They've maybe sponsored one of their staff to be able to get trained to offer our programs within their facility, or they've even served as a host site, and we've provided the leader to be able to come into their location and provide the program. So that really leads me into how is it that you can get involved if either or both of these programs piqued your interest and you're wondering, okay, well, what can I do to get involved? You could sponsor a leader. So getting one of your paid staff to become a leader. We cover the training costs of an individual getting certified in either of the programs. It's just that you would be paying their paid time, to offer the program in your organization. You could learn about upcoming workshops and just simply promote them for us as they come out by joining our listserv, which if you're interested in that, the best way to get on our listserv is through emailing me, and I'll get you on that. And my email will be on the last slide. You can refer your participants to our program. So if you want more information on our program so that you're able to share that with your participants or clients, I'm happy to get you that information. Again, you could be a host site for your workshop, or you could become a leader yourself. So there's a few different ways to become a leader. No matter what, we really pay for your training expenses, just through grant opportunities that we have to be able to extend our program out. And then we also have a program called the Master Health Volunteer Program. And if you've heard of like the Master Gardener program, it's really similar to that. So you as an individual would go through 40 hours of training to become a master health volunteer, just like a master in the knowledge you would need to be able to provide these programs. And after you've completed that 40 hours of training, you then are a master health volunteer intern. So you can go out and do programming within the first 12 months. You have to complete 40 hours of volunteer service. And then after that 40 hours of volunteer service is complete, you are known as a certified master health volunteer. So that's another way to become a leader and be able to offer workshops, host educational booths at health fairs, or even do what I'm doing today and give presentations on the programs. And I know my last few images didn't pop up. So do we have any questions? And I'll drop my email in the chat box.
Yeah, that was super exciting. Thank you, Hope. It was a bummer those images didn't show up, but we'll attach the PowerPoint to our follow-up email so you can see all those images yourself.
Yeah, I don't know. I mean, like I said, you would think I'd be an expert at this by now, but there's always going to be glitches no matter what, I guess.
Yeah, there's always a technical difficulty. That's okay. I kind of like to reiterate just how important this topic is, because as the title kind of, pushes towards, exercise is medicine. I really think of it like that. And as any kind of medicine, the wrong prescription can be very dangerous. Seriously, it can really harm people. And so that's why that's why together we're promoting these two programs, because that research-backed program is so important. You can do anything, and I'm sure a lot of people have a lot of exercise information, but when you have that research-backed stuff, it's just a proven fact that this result will happen because of this stimulus, which is super important, especially when we're talking about the populations and communities that we serve. We want to provide the best for them anyway. And like I say, the wrong prescription of the exercise can be just as harmful as a wrong prescription of a drug, in my opinion. So like I say, that research base is very important. Let's see. Yeah, any questions for Hope? I'm here. One question I have that I didn't hear you. You cover, Hope, was how much would it cost for a participant to join either of these programs?
Yeah, that's a really great question that I should have included. The wonderful answer is nothing. It's always free to all participants, whether it's in person, virtual, wherever it's located. We always want to make sure that it is free for our participants.
Right, that's the best answer, I think, free, right? And even the training that you provide to leaders and such is also free.
Yes, so for the duration of our grants, that is something that has been written in. So at this time, we are able to offer the training for either program at no cost. That's not set in stone for the next 2 years or anything. So you can't come at me in 2 years and ask for free training, because I don't know where our grant funds will be. But yeah, at this time, we are able to provide covering the cost of the training itself. They can be done virtually, thank you to COVID. So we're really trying to keep with that virtual training platform, because it's so hard for individuals to be able to come together in person. For Walk With Ease training, that is always done online, so that's really nice. But for Fit and Strong, it's been like an 8 to 12 hour training just based on your past experience. So we've been able to condense that to, you do a self-study for about 5 hours at your own pace online. And then there's another component where you join live over Zoom. So that's been some really great adjustments. If some positive things came out of COVID, I would say that is one of them, to just help with travel and individuals' times.
Right, and that virtual option of the program is so nice, so convenient. Also, I think that's really important that all programs kind of have that virtual option nowadays. People like options, right?
Yes.
Gina had an awesome question. This is a great question, Gina. What kind of efforts or best practices are out there to have medical providers refer older adults to local Fit and Strong or equivalent type programs?
Yeah, thank you, Gina. That is a really great question. So, to dive a little bit further into the referral coordinators that I had mentioned and how they work with different clinics and hospitals, they're referral coordinators for our Better Choices, Better Health programs. And I mean, that can get really confusing, and I could talk about that for a whole another hour. But really, we have a Better Choices, Better Health umbrella of programs. So, there's chronic disease self management programs, diabetes prevention programs, worksite chronic disease self-management programs. I don't dive into that, but these two physical activity programs that I talked about also fall under this Better Choices, Better Health umbrella. So our referral coordinators work to educate the doctors, the physician's assistants. I know that there's been like some dietitians, registered dietitians that they've worked with to just have a general understanding of all the programs that we offer. So then when they have a participant where they know physical activity or a chronic disease self-management program would be of benefit to their health, they are able to give them, they, like I said, they have this prescription pad. It has a list of our programs on it. They're able to like check a couple boxes that they think might be relevant and then give it to their patient as a prescription. And then there's that 1-800 number to be able to reach out to the referral coordinator to get more information about our programs, the upcoming workshops. You know, is there one that's coming up in person near me? Because I want to do an in-person workshop. And if there's not, we have a wait list. So then we're always able to see where our potential participants at that want a program. Do we have a leader near them? If we don't, then we try to reach out to partners on, hey, we have this opportunity. Do you have somebody that could become certified? Because there is an interest in your area. And that was really long-winded, Gina. So let me know if I didn't answer your question.
I think that was pretty darn good. Yeah. And to reiterate also, it is not, I don't think it's bad form to just go up to your providers or the clinics or the hospitals or any kind of, servicing organization and inquire about, some sort of fitness prescription. Nowadays, everybody understands, more of the holistic approach to health, and they're more than happy to provide some sort of, prescription or feedback to help people engage in it more often, more frequently, more personalized. And so asking those local providers, I think that may be just the push that they need to help either get training themselves or to really kind of push this exercise as medicine type of initiative. Great question. Any other questions? I don't see any. I think this was fun. This was really good. I think it was a good conversation. Like I say, we showcased two really great programs, free of charge for the training to provide the program and to all participants. It can be provided anywhere. Like I say, the two things I really like about both of these programs. One is the cost. I mean, that's a given right there, especially when it's a research-backed program. A lot of people are trying to sell their stuff. These people, they stand by the program so well that they just give it away because they know it works for one and they want to help. They're there to help. And so it's a heart of helping rather than trying to receive some sort of financial benefit, which is, I think, kind of hard to find nowadays. And the other reason that I really like these programs, they're really holistic in nature. And like I said at the beginning, it's more about what the individual needs, that individual want, finding and living your values in relation to exercise or movement is most important. And both of these programs kind of reiterate and focus on that component. What are your goals? Or let's make some goals regarding this movement modality. I think that's a really nice proponent to kind of push both of these programs. And so I like that. I like it a lot. So I think with that, if you guys have any other questions, feel free to send either myself or Hope those, and we'll try to get those answered to you. I'm going to send the PowerPoints out. I'll also send the recording out to everybody as well. But Yeah, really happy you were here. Also, I want to mention again the survey. If you please take 2 minutes to take that survey, it best lets us know how we can proceed and continue on. Next month, our community health webinar series for August, we're going to have a great guest, Hudson Kingston, who is a lawyer, attorney at law, and he's going to talk about commercial tobacco cessation policy, as well as some environmental impacts that e-cigarettes tend to have. And so it's going to be a good topic as well. But to conclude, I'd really like to thank you, Hope, for participating, for sharing your time and resources with us and our community. I think, as always, we're better together. The more we work together, the more of a holistic approach that we can bring to the community as a whole. And I think the better off everybody is just because of it. So thank you so much for your time and effort. This was really fun. It was great to work with you again.
Yeah, thank you, Sean. Thank you for having me and letting me share about our programs.
Excellent. And of course, if anybody has any more questions, we'll make sure to include Hope's contact information as well. So thank you all for being here. Really appreciate you, and we'll see you next time. Take care.